have life-saving drugs to treat diabetes. And these are wonderful because many years ago, people would lose limbs, they'd lose vision, they'd lose their kidneys, they'd be on dialysis. And if it weren't for these life-saving drugs, they'd be in big trouble. However, diabetes is broken into the microvascular and the macrovascular. And the microvascular means small vessel disease, and the macrovascular means large vessel disease. When you have microvascular, we're able to lower the sugars with these medications. And but when we have the macrovascular, that's the cardiovascular disease risk. So when we lower the sugars, we're not reducing the risk of cardiovascular disease. We're not reducing it significantly. There is one medication that supposedly reduces risk about 30-something%, about 38% at most, but we're not really reducing risk tremendously. Whereas when you have lifestyle modifications with dietary changes, you can actually reduce the risk of not only diabetes and treat diabetes, but reverse diabetes and the complication of cardiovascular disease. Why is this significant? Because diabetes patients are at 2 times increased risk, or 100% increased risk of dying prematurely from cardiovascular disease.
Wait a minute, did you just say 100%?
Wow.
100% increase. And it doesn't matter how much medication you put on, you do not really reduce this risk dramatically. And they used a trial called the ADVANCE trial and the ACCORD trial. The ACCORD trial had 10,000 plus patients in it, and so did the ADVANCE trial. And they were trying to get the A1C, which is the 3-month sugar, lower than, instead of 7, which is the mark that we use, we wanted to get it lower than 6, because we wanted to get people to be non-diabetic or non-diabetes level. And the problem was, when they got down to about 6.4, 6.5, more patients died. So
well, how many medications did it take to get them
down to 6.4, 6.5? Great question. It took 4 medications. They had polypharmacy. And that is what caused them potentially to die. Too many medications interacting. So you can't do this with just medications. But I did a study with Dr. Joel Furman, where we did a case series. So that means that it didn't have a control arm, and there were 13 patients. So it was not the optimal study. But what it showed was, over 6 months, patients were on an average of 4 drugs, and they were able to get down to 1 drug. And that included diabetes drugs, but also cholesterol drugs and high blood pressure drugs. And their A1C was 8.3, and they were able to get down to 5.8, which is a considerable drop in sugars in a 6-month period.
When they did that and they got down and they were still on 1 medication, typically what was that 1 medication? Was it like a diuretic? Was it?
It would be a blood pressure medication typically, but it could have been a cholesterol medication. But I've seen in my practice, I've been able to get people off medication, period. The other thing is, people always talk about weight loss when it comes to diabetes. If you just lose the weight, the sugar will go down, okay? And I've been saying for the longest time, that's not true. Weight loss is only one component. Weight loss is important, but it's not just about the weight loss.